Well, thank you, Marlisha. I really appreciate that. I knew it was going to be difficult following her. Certainly someone that we're very, very proud of at the FSU College of Medicine. It's certainly my pleasure to be here with you today as the Dean of the College of Medicine and once again affirm the incredible relationship that we have with TMH and our partnerships in developing residency programs here. I congratulate TMH on their vision 40 years ago for starting a family practice residency program in 1973. Something that not a lot of hospitals did at that time, and I've met a lot of hospital CEOs that wish they had done exactly this because it's made such a difference in the community. Now we're at the point where we need to expand residency programs. The Florida State University College of Medicine really was started to produce the kind of doctors that Florida needs the most. We've graduated 680 students so far in our first 9 classes. We're very proud of what they're doing and where they're going. But unfortunately, for the last 3 years, about 2/3 of those graduates have gone out of state for their residency training. We are now in the state of Florida, because of the expansion of the number of medical schools in the state of Florida, graduating more medical students than we have first-year seats in residency education programs in the state of Florida. What that says is that Florida is a net exporter of medical students right now. We believe that our model of medical education in the community is actually more likely to bring those students back, or those residents back from their out-of-state residency programs, and our initial data would suggest that. But Florida does have a problem. It ranks 46th in the country in the number of residents it has per 100,000 population. That's a direct relationship to the fact that Florida has grown so quickly in the last 10 or 15 years. I very much appreciate the governor's office and the legislature in recognizing this problem and beginning to put funds toward that. The money and the slots for this last year are great in terms of what they're doing for the future. We hope to continue that relationship. We hope to continue to have more money going forward. And we're lobbying on a regular basis to say, this is what we really need, this is where we need to go. The people behind me, who I'm sure are very tired of standing there, are an example of what we can do together in partnership. As Mark has suggested, we've partnered with the internal medicine residency program in the last 2 years. We're in the midst of a surgery program director search right now to start a general